You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. We're calling it full mouth reconstruction. According to my first guest, your teeth are never too far gone to have the smile you've always wanted. With us, we've had him on the program before, Dr. Brad Rigby. Dr. Rigby, welcome to the program.
All right, thanks, Randy.
Now, I know you brought a lot of photos, so we'll get to as many of those as possible. And we're here to talk about full mouth reconstruction, but a big part of your practice is dental implant dentistry.
Correct.
So who's that typical, I know you don't have a typical patient, but who's kind of like the main groups of people that you see for implants?
Well, so if we're talking about a single implant, then, that's just pretty straightforward. But the typical patient that is coming in looking for a full mouth of implants is people that have failing teeth that have been doing, spending years and years and lots of money trying to save all of their teeth. And it costs a lot of money, with redoing crowns and redoing root canals and bridges that are failing, that are not lasting more than 10 years. So yeah, there's lots of different categories or types of patients that are coming into our office looking for implants. So most of these people feel like they're gonna end up in a denture because their teeth are failing them. And we have options for them, to get implants or teeth that are supported by implants.
Okay.
And we do it all the time.
Well, this is a big part of what you do. We're going to talk about this hybrid protocol in just a moment, but the denture wears. You say it's tough to get these denture wears to come in.
Yeah, because they feel like they're done with dentistry. They're, that they don't need to ever go to the dentist again. And, that's so not true. They are unable to eat and function. They're limited in the things that they can eat. You watch, I hear stories of this all the time with people wearing dentures that, they'll look at a menu and they'll look at something that they want to eat, but, they end up choosing on something that they can eat.
Like soft. Okay.
Unable to, bite into a sandwich. I have a lot of times I'll talk to patients that come in with dentures and I'll put my finger in their mouth and I'll ask them to, bite my finger as hard as you can.
Really?
And it doesn't hurt. No, it's amazing.
So there's just not enough biting force of the denture?
No, because they're just dropping down in the back, or popping, off the roof of the mouth, or they're coming up from the bottom. So yeah.
And you say literally, if everything works out right, on the day of the procedure, they could walk in with literally no teeth and walk out with teeth.
Absolutely, yeah. And a beautiful, natural, set of teeth. I'll have patients that actually bring in pictures of what, they looked like, back 20, 30 years ago, and they're like, I want to look like this again.
Okay.
And we're, through the smile analysis and pictures and measurements and all this stuff that we go through, we're able to achieve that for them.
Now, you're excited about this hybrid protocol. You believe that all dentists that practice implant dentistry, and I don't want to put words in your mouth, should be doing this hybrid protocol because it's a faster, more efficient, more predictable way of giving people back their teeth. Tell me about it.
Well, so most people have heard about these, this big industries out there that are doing teeth that, walking in and out with teeth in a day, but they're actually getting just a temporary set of teeth. Okay. With the hybrid protocol, we're able to get them a fixed solution within a month.
So a brand new set of teeth that don't come out.
Yep, the only way it can come out is with the dentist. A dentist needs to take it out. So I just find that it's less appointments, less time for patients having to take time off of work. So it's actually a way of getting a patient's, their teeth in a very short time, within a few weeks.
All right. Now, when you talk to your dental buddies, do you tell them about this hybrid protocol? I'm calling it a protocol, but it's like a system to get new teeth.
I do. Yeah, okay. I've been doing, implants for 20 years, and I used to do it the old way for, the last 10 years, but just in the last couple of years, I've been doing this hybrid protocol and, being able to get patients this new set of teeth that are more stable, they're able to function more.
They can eat whatever they want.
Look amazing, yeah.
They can eat whatever they want?
Eat anything that they want.
How old can you be to do this?
Oh, you could be in your 90s.
So it doesn't matter. Age doesn't matter.
Age doesn't matter.
What's your oldest patient that got this hybrid brand new set of teeth?
93 years old.
Really? Were you like a little afraid on a 93-year-old to do the procedure?
No, not at all. One thing that is nice is we're able to do it all in the house, in our office. We do the surgery, we do the the restorative part. We're able to do the scans all, at my office. And so this 93-year-old would have been wearing a denture for the remainder of his life. Now he has a new set of teeth that he's able to eat anything that he wants.
Now we have to move on to today's topic, which is full mouth reconstruction, but you brought a video of this hybrid protocol. So what are we looking at?
It's a short video just showing, our patients how the teeth are attached to the implants.
Okay, so what we're looking at is, this would be like a denture where somebody who had to do a full mouth of extractions. They just kind of go right in there, teeth go on top, and they can eat whatever they want.
They can eat anything that they want. Yeah, and the prosthesis is actually screwed into those implants, so they can't take it out. It's the next best thing to having their own teeth, to be honest.
Okay, good. Now, full mouth reconstruction, today's topic. Let's give a working definition of what that means. Like that's dental talk, right? You guys call it full mouth reconstruction. What does it mean?
Well, a full mouth reconstruction could be a whole array of different things. It could be something as simple as just some smoothing and filing and reshaping, recontouring the teeth to get somebody a smile. I've got a pictures of something like that.
Let's take a look at some of these.
Yeah. So this is Jason that came in, and he actually was just looking to a better smile. He was very self-conscious, very aware. He's wanted to fix his smile for years. And yeah, just through a combination of procedures and some veneers, crowns, we were able to get him a new set of teeth.
Looks very nice.
Yeah, and he's very happy. He owns his own company. He's a business owner. And it's interesting, just a couple weeks ago, his wife came up to me and said that a couple of his employees came up to him after he had the procedure done and was asking, how do you keep your teeth looking so good? And, because, when we are building a smile or making a smile, we want it to look natural. And, we don't want somebody to look at their smile and say, oh, do you have veneers or crowns? And you can't tell. And they couldn't tell. And they kept asking him, kept probing and asking him, how do you keep your teeth looking so good? And he's like, just go to Rigby Dental. So I want you to look at the after photo. There's a lot of work that goes into designing somebody's smile and creating, what looks good and everybody, everybody's teeth are different. So we want to find something that looks natural to, Jason's face. And if you look at that after picture and you look at the canines and the lip line and how his upper teeth are just touching the lip line,
it's like they fit perfectly. I'm not trying to side with you, but so is this designed on a computer, or you do it? It's a combination of both.
It's a combination of designing it on the computer. It's sitting down with the patient. We've got like a library of smiles, that we sit and design it. Then we'll actually do a wax up of what we think we want the teeth to look like. And then when we get the patient in and we're prepping the teeth, we put the temporaries on. The temporaries look almost identical to that. And he's wearing that for a few weeks, and that gives us some time to make sure that he's happy with the shape, size, color of the teeth. And like I said, those are just temporaries, and then he comes back in, and if there's any changes, we make those to the temporaries and we cement the permanent ones on.
Now, what if you have like bad gums, like gum disease? Could you do this? Could you do some of these things?
Yeah, well, we'd first want to clean up the gum disease and get rid of, any failing teeth or, root canals as needed. But no, you're never too gone to get a smile just like that.
Okay, good. So you have more photos. What are we looking at here?
So this is Scott that came in, and believe it or not, he's smiling and he's got a denture in there right there.
Okay.
And if you look, you can't even see anything. You can barely see his bottom teeth. And he was just very self-aware of that, self-conscious, wasn't very happy. So through a combination of procedures, we were able to get him a new set of teeth.
Looking good.
Yeah, if you look at that, he's smiling, and now you can actually see his teeth. And he's able to function and chew and eat anything that he wants.
So what do they like more, the way it looks or what they could eat?
Oh, everybody's different, Randy. Because we've got some people that just come in because they're self-conscious and they just want it to look better.
Okay.
And some people want to be able to, eating and chewing your food is a big deal. And especially denture wearers or people with partial dentures are not able to chew their food nearly as well as, somebody now with Scott, he's able to eat anything that he can.
Tell me this, why would somebody want to get if they're only missing one tooth, why a dental implant over a regular bridge? Help me understand that.
So a bridge, especially, if you're just missing one tooth, you're cutting down, teeth on either side of the space that are healthy, most likely healthy. So you're damaging them, ruining, healthy tooth structure in order to replace one tooth. So you're 3 teeth are affected.
How long do bridges last?
So bridges, studies show they last, 25% of the time they fell within 10 years.
Okay.
I've seen bridges last 30, 40 years, but that's not the norm. I'd say typically it's less than 10 years. Well, so Randy, bridges have been around forever. But unfortunately, you're having to cut down healthy teeth in order to do that. But whereas an implant, it's probably the most successful thing that we do in dentistry. And you get an implant, you get a tooth on it, and you should never have to worry about that tooth ever again.
So in the long run, it's much less expensive to get an implant over a bridge?
Yeah, because if you have let's say you have a 3-unit bridge and it fails in 10 years, now you're going to a 4-unit bridge or a 5-unit bridge. And so it's just down the road over the years, you're having to spend more money. So yes, it's less expensive to do an implant in the beginning than getting a bridge and having to replace it every few years, or sorry, every 10 years.
Okay, good. Now you have more photos. What else are we looking at?
So this is Tom. He's been coming to my office for about 20 years. And over the years, we've just been trying to get him to do get work done, but he just keeps putting it off for whatever reason. But just a few years ago, he came back in after being gone for about 10 years, and he looked, his teeth were they were failing him. Okay. He was having a hard time functioning, chewing food, he was self-conscious of his smile. So just through a series of simple procedures, we were able to give him a new smile, going through a smile analysis, and look what it does to his face.
He looks like a different guy.
Yeah. Just last year, I ran into his wife up at a tailgating party up at the University of Utah.
Okay.
And he wasn't there, or he wasn't at the tailgating spot at that time, but his wife was there, and I came up and I was like, "Hey, how are you doing?" And she says, "Brad, we went to high school together." She's like, "Brad, what you did for my husband has changed his life." And
nice.
She actually she teared up and got out of her chair and gave me a big hug, and it was really special. And then, sure enough, Tom comes up a couple minutes later, and he was just smiling and happy, and so I just love doing that. It's a passion, loving to give somebody a new smile. It changes their life.
Now, you're a dentist, so it doesn't surprise me that you think the smile is like one of the most important things. How important is it?
Regardless if I'm a dentist or not, studies show that the smile is the most important thing. It's, the top of things. It's what you look for in family members, what you remember, your grandmother's smile or your wife's smile. So yeah, it's very valuable, very important.
We're gonna take a quick break. We come back, more of the photos and more about the process. If somebody really has a broken down mouth and what that consult looks like and how do you determine where you're gonna go with it. So we're gonna take a quick break. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
Okay, Tina, here's the big reveal.
Okay, I'm ready.
Okay, here we go.
Oh my gosh. These are cool.
Awesome. They look awesome.
Thanks.
You're so welcome.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, full mouth reconstruction. According to my first guest, Dr. Rigby, he says nobody's teeth or their gums are too far gone to have the smile you've always wanted. Dr. Rigby, welcome back to the program.
All right, thank you.
Now, we should mention your center. Many centers, you're sent out to maybe the person that does the root canals, like the endodontist or the surgeon to place one implant. You do it all under one roof, all right there.
Yeah,
Is that right?
we're able to do everything. We do the scan, we do the surgery, we do the restorative part of it. Yeah, everything, root canals. We're not really limited on anything that we do.
You're always going to after dental school. I mean, I think you said you're always going to ongoing training. Is there that much to this?
Yeah, there's a continuing education. I love it. I feel like I'm taking a course every other month, just
right?
to learn. I want to keep up to date. I feel like our office has got state-of-the-art technology, and we've got the CEREC to make same-day crowns, and so we do it all in-house.
And because you're making the teeth right there, you're able to pass the savings on to the patients?
Yeah, absolutely. Yeah, we have, a whole set of financing options, that are available.
So there's like specific lenders that loan money for dental procedures.
Yeah. There's several different companies out there that
But you
lend
told
money.
me in the green room, these lenders don't cover certain parts of this procedure.
Yeah.
And you're making a joke about it. I love it.
Yeah. When we're getting into doing full mouth rehabilitation or reconstruction, whatever you want to call it, we have financing options for that. What we don't have financing options for is for how social they're going to be, their parties, their dinner,
the
parties, the vacations, the cruises, that's what we cannot finance.
It's funny too, because, especially at 60, 70, 80, like you say, a lot of these implant cases, that these people go on cruises, these people are, their life revolves around eating. If you're lucky enough to be 75 years old or 80, it's like eating.
Yeah.
And you say a lot of people can't do it.
Yeah, that's right. I'd like to show you,
Yeah.
This is Tina. She came in and she's very self-conscious of her teeth. Didn't want to smile. She actually works with lots of little kids, and, kids are always very honest.
They make fun of your teeth.
They sort of make fun and point out, imperfections or issues with our teeth. So she came in, and just through a series of procedures, we were able to give her a new smile.
Looks good.
And what's interesting is she wanted us to film her seeing the teeth for the first time. So we gave her a mirror. I'm actually sitting in the chair, hand her the mirror, sit her up, and she literally broke down in tears with how happy she was.
And that's common. You see that a lot.
Oh, yeah, all the time.
Do you ever get choked up, or your assistant gets choked up?
Yeah, I get choked up. I got, another patient that I want to talk to you about. Okay, so this is Emery. Unfortunately, she was in an accident and lost some teeth. And so, if we didn't get involved and go through a series of procedures and replacing these teeth, she would have been in a partial or a bridge, and the bridge would have failed, or the partial, and it's just been a domino effect. So just through some more procedures and get some implants in there, we were able to fix her smile. And this is one that I got choked up about, because when it got all done, she just broke down in tears, and both my assistant and I, got welled up in tears.
Yeah,
it's
very nice.
Emotional.
So she had to be, because she had to have been scared to lose your front teeth.
Yeah.
And then to find out you get them back. So this is like what, 2 or 3 implants?
This was 3 implants to replace the 3 missing teeth.
Because they look real. I mean, this looks natural.
Yeah, it does. I mean, we went through the same thing, the smile analysis and measurements to determine the appropriate size, shape, and color of the teeth that, best fit for her.
So young people too, and older people
yeah, she's
can take advantage of.
Yeah, she's in her 20s, Randy. And, she's going to have those teeth, for the rest of her life.
As long as she takes care of them, they're going to last as long as she lasts.
Absolutely.
Okay, good. Let's see some more.
Okay. So this is Larry. Came in, quite the character. He just wasn't happy with his teeth, was able to chew, function. So we had to clean up his gums. We had to, get rid of some cavities, and but just through the same thing with the smile analysis and pictures, measurements, and we did the wax up. We were able to give him, a new smile.
Looks good.
And he is extremely happy about it. He's able to chew and eat anything that he wants.
And now, what about sedation? What are they getting for this?
So for sedation, we do minimal conscious sedation, where it's as simple as they take a pill. They're awake, during the procedure, but most of the time they're sleeping. But we're checking on them, we're monitoring them. But yeah, it's just by taking a pill.
So they're numbed up. They get a little bit of medication, and they're just relaxed. So during the procedure, they're not feeling anything.
No, they're numb the whole time.
Okay.
But yeah, just by taking a pill before they come into the appointment, and yeah, we anesthetize them. A lot of times they get a little amnesia effect from it.
Is that right?
So they don't even, the next day they don't even remember, the procedure, for the people that are really scared to go to the dentist.
Now you see, like when it's all done, like you do one of these full mouth reconstructions, that you see personality changes. Like a big deal for some people.
Oh, absolutely. With all the people, the photos that I've already shown you, every time they come back in, for a cleaning or checkup, you can just see they're personality has changed. They're smiling more, they're joking more, they're friendly. They don't look, sometimes they look grumpy or or not approachable. And it's a transformation, to giving somebody a new smile. And seeing them come back in over months or years for checkups.
So it's like a boost in self-confidence.
Absolutely. Their self-esteem is completely different.
Okay, good. You have more photos.
Yes. So this is Terry. He came in and, just through same thing. We went through a smile analysis with him. He actually was, not all that happy with his smile and he came across very grumpy. And, my office staff, liked him, but he just wasn't very personable. But after, through a combination of procedures and fixing his teeth and recontouring them, and I think we did an implant, he's a different guy. And now he smiles, he's laughing, he's joking, and my staff's always loved him, but now he's just more personable.
So you just it's like anything in life. If you don't like something about yourself, it kind of holds you back. So when you give them their smile back, they're back.
Yeah.
Are they doing selfies and things like that on Facebook? Or what?
It helps with their self-esteem, to have somebody with a smile. It just brightens their eyes, and it's amazing. Okay, so this is Dan. He is not one of my patients, but I just wanted to give you an idea of what can be done, a transformation that can occur, from a before and after. Being a hybrid certified doctor, I'm able to do this all in my office with our CT scans. He walked in with his teeth looking like this, and 3 weeks later, that's his final,
very nice.
His final teeth, and he's able to eat and chew anything that he wants.
Looks very natural.
Yeah, it does, and he's very happy, from what I hear.
Are you one of the only guys in Utah using this hybrid protocol?
As far as right now, yes. There's only, I'd say, less than 2% of dentists in the United States are actually hybrid certified. Here's another one, Randy.
Right.
This is Heather. She came in probably about 15 years ago, and man, she just is a grinder and clench grind and just breaking her teeth right and left. And she wasn't happy with how short her teeth were if you look at the before picture. And, so we were able to redesign her teeth with a wax up, and we actually ended up doing veneers and crowns on her teeth to recreate her smile, and she was very happy about that.
Now, you say that losing teeth is expensive, that even though you do dental implants, you like to save teeth whenever possible. Elaborate on that.
Yeah, no, absolutely. I'm in the business to save teeth. That's, being a dentist, that's what we want to do. But, there's big industries out there that they have one solution, and it's to take out all of your teeth, put in some implants and replace them. And I just don't believe that philosophically. I just don't.
Interesting. Okay.
I'm not, even though I do place implants and I do, do full mouth and full arch stuff, I'm in the business to save teeth. When somebody's teeth are just too far gone, we need to find a solution, and that, could be with implants, but not everybody is a candidate for taking out all of their teeth. Even if they're 80 years old, I've seen a lot of really healthy teeth for an 80-year-old, but some 80-year-olds, I do believe, need some work.
Because, people don't really want all their teeth taken out, right? Do they come to you saying, can you save some of these teeth? What do they say?
Yeah, through the years, and people have spent a lot of time and money trying to save their teeth, and nobody wants to lose all of their teeth, Randy.
Okay. Now, we have time for a few more photos.
Okay.
And it's nice that you have stacks and stacks of these photos. The patients, when it's all done, they're going, hey, you could use my photo sometimes?
Yes, well, we get their permission, obviously.
Yeah.
But yeah, they're just so happy to share their, the changes, the transformations that, they're more than willing to share their photos. Okay, here's another patient, Randy.
All right.
So this is Jim. Jim actually this is a typical patient that we see, that somebody that has gum disease, broken down teeth. He's struggling with eating. You could see that his teeth were flaring. And he wanted to do something that would take care of it, and because he was just getting tired of constantly putting money into a crown here, a root canal there. So we were just looking to fix his teeth.
Okay.
And you can see what we did.
Looks good.
And he is extremely happy with that. He is able to eat and chew anything that he wants.
The things you do, you say like they're built to last. That means your goal is you want to do it like in one shot, so that way they, other than cleanings, they don't have to go back to the dentist.
Yeah, he walked in with his teeth like that and walked out with his teeth like that 3 weeks later on the after picture.
So when a guy like that, because this is a big difference, when he looks in the mirror, what does he do?
Well, he smiles. He's happy, and I think he's just got more self-esteem. I mean, to get him to smile on his before pictures, that was pretty hard to get him to smile. Even though he had a lot of charisma, he just had all that much more, in his after picture. Okay, this is Denny.
All right.
Denny came in and just wasn't happy with the size and shape and color of his teeth. Just over the years, he had worn them down, as you can see. They're pretty short. So he just wanted to, get a new smile, and we were able to do that through some simple procedures, some veneers and crowns, and we were able to lengthen them to give it that more natural look. And
looks good.
Yeah, thank you.
We're out of time. Final message: somebody watching this, and they're the kind of patient you described, really broken down teeth, really bad teeth, but they hate their smile maybe. And they've heard what you had to say, but for whatever reason, they don't like going to the dentist, or they're putting it off and putting it off. What do you say to them?
I would say just give us a chance. We've got really good ratings and reviews at my office, and we've got an amazing staff. We offer a free consultation. Just come and give us a chance. It's just to meet us. We don't have to do anything. We can just talk, and we can find out what your concerns are, and discuss what we can do for you.
Okay, good. I want to thank you for coming to the show. Good stuff. And if they want to get an appointment, do they get to see you?
Yes. They get to see me.
Okay, good. And they just go online, make an appointment there, just call your office directly.
Go to rigbydental.com, and you can schedule an appointment online. We're really good with communication, or you can call us at the number that's probably being listed.
Okay, good. Thanks again for coming on the program.
All right, thanks, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.